Good evening, members and members of the public, and welcome to the Adult Social Care and Health Committee. Can I just remind all of the members and attendees who are here to turn off their cameras and microphones until you're asked to speak, and if you could indicate to speak by putting your hand up, please, rather than in the chat. It's but easier to notice you that way. Just checking that the sound is working okay on the webcast. Yes? Can we get that confirmed? Good, thank you very much. Okay, in that case then, if I could invite Vicky Shaw to do a roll call, please, Vicky.
Thank you, Chair. Good evening, members. Councillor Berry?
Yeah, good evening. Sorry about that.
Councillor Burgess-Joyce?
Good evening, Vicky, Chair. Thank you.
Councillor Collins?
Good evening, Vicky, Chair.
Councillor Cottier?
Yes, good evening, everyone.
Councillor Frost?
Good evening, Vicky. Good evening, everyone.
Councillor Gilchrist?
Yes, good evening, everyone. Phil Gilchrist present, thank you.
Councillor Cannon?
Good evening, everybody.
Councillor Jordan?
Yes, good evening, everyone. Councillor Jordan here.
Councillor McLaughlin?
Evening. Councillor McLaughlin here.
Councillor Usher?
Vicky, can
Evening,
I say
Vicky.
this is a...
Evening,
oh,
everyone.
sorry.
Councillor McLaughlin?
Say at an earlier meeting, Councillor Usher indicated he had no internet today and maybe he was having problems, but I see he's here.
Yeah, looks like he's resolved those, yes. And obviously Councillor Nolan is in the chair. So I think that's all the members of the committee present, Chair.
Thank you. Thank you very much. So if I can just remind everyone that this meeting will be webcast and a record will be retained on the council website. So for those at home who are viewing the webcast, I'm happy to inform you that if you look above the video, you will see a resources tab. And if you select this, and a link to the agenda will appear in the right-hand side. This will allow you to open the agenda in PDF form and follow the discussion and the debate. So hopefully that will be helpful. So welcome to any people who are watching this from home. Now, before I move to the minutes of the previous meetings, I'm just going to make a couple of suggestions about the order of the agenda, which hopefully the committee will agree with, but please do say if you don't see the logic of it. We have two external people who are here to speak to item 12 and item 13. We've got Simon Banks who's going to speak to item 12 and Val McGee, I believe, is going to speak to item 13. And I'm going to suggest that we bring those forward and take them right at the start of the agenda so that frees up Simon and Val after they've made their contributions. Also, item 8 has got an exempt section to it, so I would suggest that we deal with item 8, but then move the exempt part of item 8 to the very end of the agenda, so that at that point we can then deal with it with just ourselves present. Are people happy with that?
Agreed, Chair.
Agreed.
Okay.
Yes, Chair.
Good. Right. In that case, then we'll move on. Minutes of the previous meeting. Are there any comments as to the accuracy of the meeting from the 19th of November? Or is everyone content that that's an accurate record?
Agree.
That's proposed by Moira. Can I have a seconder, please?
I'll second that, Chair.
Thank you. Thank you, Councillor Cottier. That's agreed. Do we have any public questions, Vicky?
No, Chair, we don't have any public questions. There are no public statements, no questions from members, and we're not aware of any petitions, but you might wish to ask if any members of the committee have any petitions.
Yes. Do any members have any petitions now that I've been reminded? No, I'll take that silence as a no. And in which case, then we will move on to the what was item 12 and is now item 5. And hopefully he's here.
Sorry to interrupt. Can I just ask, are there any declarations of interest?
Oh, yes. Yeah, we managed to miss that, haven't I? It's interest or any party whipping arrangements. So if people could put their hands up. Councillor Berry.
Thank you, Chair. It's not exactly an item of interest. What it is, just to inform the Chair that my internet connection is playing up, and it might drop out for 5 minutes or so, but I will come back into the meeting if that does happen.
Right, thank you. And I'm sure that our IT staff will do their best to get you back on, even if it's by phone, Bruce. So thank you for letting us know that. Councillor Frost.
Thanks, Chair. This isn't my main point, but in the same place for Councillor Berry, my internet's been in and out all day, so apologies if I speak without my camera on if I need to later. Yeah, my item I just wanted an input from Vicky on was item 7, the extra care housing capital. Given that I'm also a member of the planning committee, I was just seeking advice in terms of my contributions at this meeting to item 7.
Yeah, right. I'm sure Vicky can comment, but I actually did what I said I was going to do, which was to speak to Mr. McCourt about this, and then promptly forgot to tell you the outcome.
Oh, thank you, Chair.
I'm sure that Vicky will confirm. Mr. McCourt's view was that if you were just simply voting on it as a member of the committee and not being the person leading it and arguing for it and standing up for it, then you wouldn't have an issue with planning. But obviously, if you were carrying the flag for this particular development, then that would be an issue, was his view. I don't know if Vicky has a different one. Vicky?
No, Chair, I would concur with Mr. McCourt's advice. That was what I was going to advise.
Okay, that's sorted then.
That's helpful then, Chair. So I will, as a member of both committees then, just a participating member rather than a lead member on this topic on either committee. That's clear. Thanks, Chair, and thank you, Vicky.
Okay, any other? Councillor Cottier.
Yes, thanks, Chair. I'm a director of a construction company and has a contract with NHS regarding 2A Price Street in Birkenhead. It's a crisis cafe refurbishment.
Okay, that's not the item under discussion, but yes, to know that you
just
are a
in case
contractor
it does
is
come
helpful.
up. Yeah.
Thank you.
Okay.
Councillor Usher.
Thanks, Chair. Probably not relating to any items on the agenda tonight, but just to be on the safe side, I just want to mention my employment at one of our local providers, Autism Together.
Okay, thank you. Thank you very much. Councillor Berry, is your hand still up from previously? Does it need to come down, or is it a new hand?
Yes,
right.
sorry, Chair.
Councillor Collins and then Councillor Jordan.
Yes, thanks, Chair. I've already declared this last meeting, just to make sure I declare it again. I'm a governor at the University Teaching Hospital, Larrow Park, and my daughter works for the hospital. I'm also going to work for a company which supplies training to the care sector. So if it just comes up, that's all, just declare it. Thank you.
Okay, thank you. Councillor Jordan.
Oh, thank you. I've got a problem with my internet here, Chair. Trying to jump between iPad and computer, but there's no mic on my computer at the moment, so I'm on the phone. I have conflicts of interest in that I work for the NHS and my son works for the NHS, and I'm a trustee for Incubabies, and I was going to ask the same question as Councillor Frost, but I'll take the answer that was given a few moments ago.
Okay, thank you very much. And I suppose that I should also declare that I'm a governor at Clatterbridge Cancer Centre. Given that the
Sorry,
council
Chair,
put me there.
I neglected to declare an interest. I've got a daughter who works for the NHS.
Okay, thank you very much. Right, are we all done? Good. Okay, so now we come to what was item 12 is now item 5. I'm going to invite Simon Banks to talk to us about the changes, forthcoming changes in the NHS.
Thank you, Chair, and thank you for putting me up the agenda. I wasn't anticipating it. Was most welcome. Thank you. So a similar paper to this has already been received by the Partnerships Committee last Wednesday evening. But what this does is it sets out the main items that are being proposed for legislative reform and organisational change within the NHS over the next year or so. We've just received notification in the last week that some of the planning guidance associated with affecting this reform will be delayed till after the end of March, when hopefully we'll be coming out of the COVID-19 pressures that we're currently facing. But effectively, integrating care next steps is an extension of what was set out in the NHS long-term plan. The paper sets out some of the key changes that are being proposed, which includes taking some functions that are currently delivered nationally and putting them into the North West, and then subsequently some functions that are being delivered across a North West footprint coming into Cheshire and Merseyside. The bit that is of particular interest, I hope, to the committee is around the idea that the future health and care system will be built upon the local authority boundaries, and that is seen as the place where services need to be joined up and integrated. And we believe that in Wirral we're in a very, very good position around that. The rest of the paper goes through some of the other changes, including the ensuring that providers work more closely together as being part of provider collaboratives, that governance around place is developed, that clinical leadership within the NHS is maintained, but ultimately that health and care partnerships become, such as the Cheshire Merseyside Health and Care Partnership, become statutory integrated care system statutory bodies. We are responding to this in terms of Wirral Health and Care Commissioning, which is the strategic partnership with the council, by working with the Health and Care Partnership and putting out a strong position that we believe that whilst commissioning functions will be moving from CCGs to integrated care systems, most of those functions can be and should be delivered within each local authority area in partnership with the NHS, which is what we're doing at the moment. So we have therefore commenced some work which is referenced in section 3 of the document to start to define what functions what the commissioning offer at place should look like, setting out what functions should be delivered in the borough and how that would best sit within the partnerships we already have. So the consultation period, or engagement period, as it wasn't a full consultation by NHS England improvement, finished on the 8th of January. We're still waiting to hear more in terms of the outcomes of that. But with the support of the council officers through the Joint Health and Care Commissioning Executive Group, we're currently working on looking at what functions, what finance, what capacity and capability should and could be retained within place, so that we continue to build on the strengths of our strong and effective commissioning relationship with the local authority, but also ensure that the governance of that places the Health and Wellbeing Board at the centre of it, and decision-making committees such as your own at the heart of it also. So I'm happy to take any questions on the paper as it stands, Chair.
Thank you. Thank you very much, Simon. And the spokespersons and myself had a meeting with the chair of the current, the Cheshire and Merseyside Partnership a week or so ago. And I think that was extremely helpful in beginning to look at some of the questions and some of the issues. And I think it was encouraging that he was very clear that he welcomed, and in fact I was in a political assembly meeting this morning for Cheshire and Merseyside, and they were very, very clear there that they not only welcomed but actively sought to change the board once they get the approval, which they have applied, to become an integrated care system in April. And at that point they are looking that the board will be 50% at least of elected members, and that all 9 local authorities will be represented. So that was really quite positive. I think it's excellent that the Health and Wellbeing Board is seen as being at the centre of this, and certainly will be looking to work alongside our partners to set out a strategic vision for how we can take our healthcare forward in Wirral. And one of the things that I keep on saying is, can we stop talking about ill health and start talking about the health of our population, and recognise that that links into so much of what we're doing around the local plan, around regeneration, around decent housing for people, around people having good quality employment, and the environment in which they live. All of those are such huge contributors, much wider determinants of health. And this isn't just about hospitals and surgeries and ill people, it's also about well people, and that's really, I think, important. I'm so pleased we've got our workshop on Thursday to look at the Health and Wellbeing Board, and hopefully we'll have all of our partners there to plan out how that's going to go forward. Moira, thank you.
And thanks to you, Chair. And yes, it was an extremely useful session we had the other day. And I agree with all of the things that you've said, Chair. I particularly am pleased to see that there is a heavy emphasis on that local of commissioning of services will be how decisions are made. Also keen that the governance arrangements do reflect the different communities in the Wirral and the need to have services that are tailored to meet the needs of those different communities. And also, because of the high numbers of elected members, I hope that we will see that the values and principles of the NHS, which we want to protect, can be maintained as we move towards a more integrated service. Thanks very much. No question really, just a comment.
Thank you. Councillor Gilchrist.
Yes, thank you, Chair. Last week's meeting did clarify quite a few concerns that members had, and at one point I felt like saying we shouldn't shoot the messengers, because the people who came to us from the region did really sound that they had a great commitment to the NHS and to making this new system work. I think I said in various meetings it's about following the money, and I'm pleased to hear Simon talk about the things that could and should be in our local place, because one of the things that has been puzzling me is, with so many local authorities involved, how consultation with elected members will take place, and certainly the Health and Wellbeing Board is a key player in that. I'm wondering when we start doing some more work on this structure, because of course it seems strange to me that all this is going on in the midst of the worst pandemic we've had for a century, that there's the capacity amongst health service officers to get this set up and running in a timely way. So naturally I'd like to see, I've heard just from Simon now that the guidance has been delayed, and I hope the guidance has no surprises. I'm wondering whether there is a way of having an advisory body drawn from the councils across the region to meet with health chiefs as this starts, so that they can talk about what is and isn't in the various budgets, because it's clear that some functions will move upwards and other functions and resources will be devolved downwards. So how it develops over time, all the goodwill is there, and so are all the worries that have been expressed in recent years. But with a fair wind, I'm rather hoping we can get this off to a good start with cooperation on all sides. Thank you.
Thank you. Councillor Jordan.
Thank you, Chair. Forgive me, but I didn't hear anything of what Simon had to say. My internet dropped out. I fought with it to get back onto the iPad. So I've got a list of questions based on what I've read in the report, and I'm sorry if they've already been answered. First of all, I'd like to know that what is exactly the Cheshire and Merseyside footprint? We've changed it so often over the years, gone from Cheshire and Merseyside to North West Coast and back to Cheshire and Merseyside. Are we including East Cheshire? And in terms of commissioning, who's going to decide what services are commissioned locally and what services are commissioned regionally? And what happens to those people who are currently in specialist commissioning, who've built up quite an area of expertise in commissioning the areas that they commission, which went national for that particular reason and are now coming back to be regional? Are those people going to move into the ICS? On the clinical networks, are they going to be covering the same footprint as the ICS, or are they going to be covering a North West Coast footprint as they do now, with the pathways going into Liverpool, Manchester and Staffordshire as they do now? And finally, two things that are linked really. Given where we are at the moment in the middle of a pandemic, how would critical care services be commissioned, and how will we commission the rehabilitation following critical care and neuro rehabilitation, which currently is sadly lacking in Wirral?
Well, that should be enough to keep Simon busy for a while.
Okay. The first, Cheshire Merseyside footprint is all 9 boroughs of Cheshire, so it does include Cheshire East and Cheshire West and Chester, so it includes the entire footprint. But we do need to recognise in that patient flows will also go into Staffordshire, into Manchester, and we would also import from North Wales and other places. Who's going to decide local versus regional? That's a dialogue that we need to have with the emerging integrated care system that is Health and Care Partnership, and that's the work we're currently doing within the Wirral Health and Care Commissioning Partnership. But the view of the Health and Care Partnership is that the majority of commissioning will remain in place within the local authority area. Having once worked in specialised commissioning a few years ago, this is, I think, another change. As you said, Councillor Jordan, they were taken to a regional national level. They're now coming back to a regional sub-regional level. I can't say what's going to happen to them exactly, but the proposal is that those functions would be delivered through the integrated care system at a Cheshire Merseyside level. So it's back to the footprint I worked in back in 2004, effectively. Clinical networks, I'm sorry, I can't answer your question on the footprint for them. That will be something that the clinical networks to discuss with the relevant ICSs, but certainly in terms of their current footprint, it makes sense. And critical care and neuro rehab, I do agree with you. We have some challenges around neuro rehab for our population. They will remain commissioned on the Cheshire Merseyside footprint as they are now. And at the moment, in the command and control structure that we're part of, because of the level 4 national emergency pertaining to COVID, certainly they are very firmly being commissioned on the Cheshire Merseyside footprint.
Okay. Thank you. Thank you for that, Simon. Councillor Cannon.
Thank you, Chair. I don't know if my camera's working. Can you hear me?
Yes, we can. You're a bit faint, but yes.
Yeah, I don't quite know what's happening.
And see you, so you're doing all right.
Thank you, Simon, for that. I just wondered if you could elaborate a little bit more on the single pot of finance and the resources for the ICS. I mean, obviously, you've said that with the new legislation, it will be easier to have partnership working in the local authority, and I presume what you're talking about is replacing the Section 75s. But I just wondered if you could give us a little bit more detail, not obviously figures, you're not going to know how much is involved at the moment, but do you see this process as being more fluid and better for the people of Wirral than it is, at the moment? Thank you.
So I think we have a little way to go, Councillor Cannon, on understanding what that single pot of finance means. So as part of our work around defining commissioning functions we believe need to be retained at place, we're also doing some work understanding what finances need to be retained at place to ensure that the Wirral population gets its appropriate allocation. We're working under a similar system to that now, because what happened when we went into the national emergency of responding to COVID about, well, just under a year ago, but certainly in terms of Wirral, we were responding to it with the Wuhan guest since the 30th of January of last year. Every area has just been allocated a pot within which they needed to work. So we're assuming that will take place. What we're keen to do is actually retaining Section 5 of the NHS Act 2006 arrangements, where we can pool resources with the local authorities, because that derives benefit. I think what we need to do, and just for the purposes of clarity, the Section 75 that the proposals in integrating care next steps, that the one they're proposing to abolish is Section 75 of the Health and Social Care Act 2013, the one that leads to competition having to be applied in the NHS. So we'd want to retain Section 75 of the NHS Act 2006 and joint pooled budget responsibility, so we can concentrate on delivering care rather than worrying about who pays for it necessarily. But the Section 75 that pertains to competition, the proposal is that subject to primary legislation, that's abolished.
Thank you. That's been very good, actually. It's sort of put my mind at rest about that specific part of legislation. Thank you very much.
Right. Any more questions? I can't see any more. Right. Any more questions? I can't see any more hands. So, well, thank you very much for that, Simon. And obviously there will be ongoing updates to this committee, because we will have clearly a very key role in relation to this once we're out delivering our services and commissioning our services here on the Wirral. So this committee will be regularly involved in oversight and scrutiny and decision making, and heavily involved in the whole process. So, right, thank you very much for that, Simon. And I'm sure you'll keep us updated if things change. Mm-hmm. Thanks. That was really. Then we've got Val McGee from the Community Trust, who is going to.
Excuse me, Chair, sorry to interrupt. Can we just move the recommendation in relation to Simon's
report? Which was to
recommendation in relation to Simon's report.
Which was to note it. That's what I've got down here, and to support the work that's being done. Just to note and support the work to define the commissioning offer, and to note the work in the creation of a provider collaborative. Can I have somebody to move that?
If I must just ask you, put my hand up for a moment, could I ask that we receive a report back at an appropriate time on the... Thank you.
Yeah, we'll arrange that, no problem. So if we can have somebody to move the recommendation.
I'm happy to do that recommendation.
I think we've got there. So thank you, and obviously we'll take note of Councillor Gilchrist's request for an update report. So then we move on to now item 6. Val McGee, who's going to talk to us about 111 first. The fairly significant changes into 111, and can update us, and we're not looking for a massive presentation, Val, but a brief update will be really, really welcome. So welcome, and to the committee, thank you very much.
Chair, it's Simon Banks again. I'm
Oh, it's you. Sorry, I thought you were. Thought Val was coming.
She's unfortunately she's getting engaged in COVID pressures this evening. We've got quite a lot on, so I said I'd stand in for her.
Oh, well, that's fine. Okay. Well.
We've clearly got some significant issues to deal with across the system at the moment. So Val's back, but we agreed between us I would cover this evening. Emma Danton is with me, I believe. Emma has been supporting the project. So what the report Val has produced for the committee points out that Think 111 First was actually a nationally mandated project which aims to actually ensure that people accessing urgent and emergency care are offered a single point of access, a standardised assessment, appropriate clinical support, and onward direct referral to an emergency department or other appropriate services. The purpose was to reduce the risk of what's put in here as nosocomial infection. So that's where an infection to a patient or a patient to a healthcare worker or vice versa. So it's the transfer between people. It's the transfer between people of infections that can happen in an overcrowded emergency department. So particularly in times of COVID, we're seeking to reduce the numbers of people actually attending the emergency. Also to increase the numbers of people who get to the right service for the first time. So many people will go to the accident emergency department because it is open 24/7 and will do it in a way what's referred to as unheralded. We will not know they're coming. Whereas if people use this service, the concept is actually the emergency department, if they need to go there, will be ready for them, or the right service will be ready for them after clinical triage. And also to increase people's satisfaction with the use of NHS 111 First. The project has been underway. The go live was Emma, if you could help me with this, because it's all melding into one, but I think it was November.
24th of November, yes.
That's right, 24th of November. So we've been going for just over a month and a half on this. In the first 10 days, we saw 70 advisory services being managed without the need for people to go to the emergency department. We've seen people having shorter waiting times. And also we have seen people arriving in the emergency department reduced by 9%. My role in this was just as executive oversight. Val has done an incredible amount of work with a multidisciplinary team to put this into place. And this is really the first phase of the work. We want to improve the clinical assessment service and the advanced nurse practitioner service within that. And we want to start to also extend it to other pathways, other relevant pathways as well. And again, we're doing this in the time where COVID is ever present within our operating environment, but also it's therefore particularly important we reduce the number of people attending emergency department as well. So I'm happy as best I can to take questions on NHS 111 First. And again, us coming back with this at a later date with some further data when we're further into the delivery of this service.
Yes, I've got somebody here with their hand up. Who have I got? Right. Councillor Frost, and then Councillor Collins, then Councillor Gilchrist.
Thank you, Chair. Simon, thank you very much for the report that you presented, and to Val for the report in the pack. I think it was really encouraging to read and to hear your update then, and I very much support you coming back to the committee. 2 questions, and whether you've got the answer just now or whether it's one to come back on. The first was just around, there are a number of the headlines of the report. The thing that I think was absent from the report when we discussed it as a group beforehand was a bit of a data report for us to understand the current results. So there was a number of things, for example, saying looking to improve or looking to reduce, but we didn't have that kind of context to say what were your targets against, where are you now, and then where are you looking to go. So just really appreciated the headline nature of the report, but perhaps just a data pack behind it so we can get a bit of a context around it. So things like staff and patient satisfaction was one that stood out to me there. 9.2 referenced access and language barriers within the equality implications have been identified and mitigated against. So similarly, when you come back, just to give us an understanding of which risks were identified and then what the mitigations put in place were.
Yes, we'll make sure that we bring a proper data pack next time. I apologise.
Okay. No, that was really helpful. Thanks, Chair.
Okay, thank you. Councillor Collins.
Thank you, Chair. Thanks for that, Simon. It's slightly off the mark in respect of comments made to me by residents that when they go through this e-consult, they're sent to the 111 for minor illness. For minor illnesses. Has that impacted on the service?
No, because I think we factored in the need to use e-consult, sending them to NHS planning for this. Is that correct, Emma?
Hi, yes, Simon, that's correct. There was a capacity planning undertaken across the whole of the Northwest, looking at the expected number of increased calls into NWAS who operate the 111 service because of the national advertising campaign and other initiatives.
Thanks for that, Chair. Thank you.
Okay, Councillor Gilchrist.
Thank you, Chair. Yes. It's a very succinct and accurate and to the point report. We've spent many times in the past discussing 111 and how it was working. Could I ask about the public perception of it, how it's been received? Because the long-standing worry years ago, it's decreased in recent times though, was getting it right first time, that when someone is assessing a citizen resident with a worry and a problem, that there are the people with the appropriate skills and qualifications to identify what is actually wrong with them and make the right direction for these people to go in.
Thank you. Simon, do you want to come back on that?
Yes, so there's a couple of points, and there's actually about the satisfaction of people using the service itself. So we're still doing work on sort of user satisfaction, and we are monitoring also in terms of the outcome measures of are we diverting people from ED, and we're finding on average 70% of people contacting 111 first are moved away from that department, and also people are then spending less time in the emergency department. But I think again, going back to Councillor Frost's question, Councillor Gilchrist, we probably need to present a data pack, the metrics that we're measuring this service against, so councillors can see that and can see the target versus actually what we are delivering.
Right.
Come back on the point of, in the report through you, Chair, it mentioned that an advanced nurse practitioner has been recruited. So is Simon able to say that we have, when people do telephone or go through this service, that there is a range of experience to identify things as much as possible right in the first place?
That's correct. So the clinical advisory service element of this is staffed by qualified practitioners such as advanced nurse practitioners. And again, the idea is that then is expanded to include mental health nurses and so on going forward, so we can deal with more presenting conditions in an appropriate way, and then keeping behind that a really up-to-date directory of services is essential. So actually we know that the services are available readily for that person to go to.
Right, thank you. Thank you, Simon. It's encouraging to know that that there are people with clinical skills and knowledge and qualifications involved at this stage. We've all seen what happened with doing things by algorithm with exams this summer, and looking at people's health by an algorithm is way more serious than that. Councillor Green.
Thank you, Chair. And you'll forgive me, I know I'm ex officio and only allowed to speak by your say-so, so thank you very much.
Oh, how lovely. So I can step back if I feel like it.
So thanks for the invitation. Yeah, my question, I suppose, to Simon and Emma, and this is, I understand the need to move this way and so on, but I have a degree of personal experience where, you know, we talk about e-consulting, we talk about 111, how people can, you know, give up from the going through the system and, you know, having to go onto the computer, then phone this, that, when all they really want to do is, you know, they've got a problem and they would like the doctor to help them with it or something. And to try and deal with that group in terms of people who will, you know, give up and just kind of soldier on rather than actually have what could be, who knows, because we're not doctors, so to speak, could have something that's quite serious and might actually subsequently develop into something else. This sense that there's a kind of electronic, you know, fence that's been put down between the patient, the GP, and the other elements of the health service.
So,
thank you, Chair.
I think what we're conscious of, Councillor Green, is actually this is not necessarily the system for everyone, and as you've just said, there's the potential of an electronic fence between people and the service. So we are certainly encouraging one first as much as possible, but that doesn't mean that other alternatives for their care aren't available to them, and there is clearly still the ability to go to those local services as well. We do have a Wirral Health Inequalities Group, or Wirral Inequalities Group, that's looking at the key determinants of health alongside colleagues in public health. But it's particularly looking at digital poverty and the digital gap that's certainly appeared during COVID times, where and it's particularly acute in parts of the borough, and therefore looking at how we can continue to push and support with public health support messages about how to access services if you don't have, or indeed don't have the ability to do so over the telephone. So I think that's still factored into our plans, is it, Emma?
Yeah, absolutely. And it was one of the key parts of the national messaging as well, not just of the local or regional messaging of the campaign, is that all existing physical pathways.
Okay. Any other?
Thank you, Chair. Sorry.
That's fine. Okay, thanks. Any other questions?
I put a note in the chat, if I may, Chair. Just to ask, might I double check on how walking facilities fit in, though they're by appointment?
Through you, Chair, Councillor Gilchrist, they're on the directory of service, so they are referral points for NHS 111 first. Miriam, and have I missed one?
Arrow Park.
Arrow Park itself, yes.
Okay, thank you for that. Okay, thank you for that, Simon.
Thank you.
Let's see any other hands shout out now. Forever hold your peace. Do we have the recommendations are to note the contents of the report and to support the implementation of phase 2?
I'll move that, Chair.
Thank you, Councillor Frost. Seconder?
Seconded, Chair.
Thank you, Councillor Usher. There we are. Well, thank you for delivering both reports for us, and you're welcome to stay, but you're also free to go.
Thank you. I've got a bit
Okay,
of
thank
work
you.
to do, so thank you very much. Thank you,
Okay,
Evan.
I'm sure you've got plenty of other things.
Thank you,
Okay,
Evan.
I'm sure you've got plenty of other things to do. The rest of you are not free to. So now we are moving on to what was item 5 and now item 7. Review of the day services contract for people with a learning disability. And that's over to you, Graham, please.
Thank you. Good evening, Chair, and good evening, committee members. This report is intended to provide information related to the budget proposal for Wirral Evolutions, so that members have a greater depth of knowledge in relation to why we have a specific proposal in relation to the contract. At the end of the report, there are proposed recommendations which are specific to the contract for those day services. As members of the committee will know, Wirral Evolutions was created as a company owned by the council in order to free up the business, to extend their activities, for them to modernise, and to enable Wirral Evolutions to gain income in addition to the social care contract. This was seen as the council was and continues to face increasing significant budget pressures overall, and in comparative terms our cost for day services was much higher than other local authorities. So the creation of Wirral Evolutions was very much about the business finding a way forward in that context. As Wirral Evolutions was set up in its inaugural year, a £500,000 saving from the original contract was agreed by the business, and the business plan of the company set out how it would achieve that through extending its business, going into new areas, and making broader offers to the public. Unfortunately, over the 5 years since its inception, Wirral Evolutions has not been able to deliver this, and either to growth or new markets or efficiency. So therefore, this report is in the position of providing the background. It recommends that that we should continue to contract with Wirral Evolutions for those day services. Wirral Evolutions to present to the Adult Social Care and Health Committee in terms of its progress against delivering to the contract price of 5.01 million, and in essence, it is on the basis of delivery of the savings that the recommendations are made to continue to contract with Wirral Evolutions.
Thank you, Graham. Any comments, questions? I would just say to members that obviously the budget consultations are still ongoing. They haven't yet closed. So it's going to be difficult to for us obviously to reach any final conclusions, but of course people may want to ask questions around this. Okay, first of all I've got Councillor Collins, then Councillor McLaughlin, then Councillor Gilchrist.
Thanks, Chair. Thanks, Graham. Good evening, Graham. Just a question about the contract. How many services that Wirral Evolutions undertake? How many services that they have to take from the council? Do you know what services they've been tied into through the contract to Wirral Council?
Yes, so the contract is for day services for people with learning disabilities. They run those day services from a number of venues across the borough. It is a fixed contract that they deliver on our behalf. So unlike many other contracts where we buy places one by one, The deal with Wirral Evolutions was very much about a single contract for the full delivery of learning.
Sorry, Chair. I'll rephrase the question. What services that the council provide Wirral Evolutions are they tied into? So what services Wirral Council provide?
Okay. Yes. So in terms of back office functions, etc., Wirral Evolutions does get some of its support independently. So HR support. It has its own board. All of those things. It has its own managing director. In terms of buyback, though, there are some buyback arrangements in place, and they are to do with the legal support and finance support that the company needs to get from the council. That's the primary area. In terms of the lease at a very low level of rent, and the council continues to own those buildings, but also to provide the facilities management for them also. I can provide a more detailed breakdown for you, Councillor Collins, as well outside of this meeting.
Thanks for that, Graham. That's great. Thanks, Chair.
Okay. Right, Councillor McLaughlin, Councillor Gilchrist, Councillor Berry.
Thanks, Chair. And thanks to you, Director, for the report. And we have looked at Wirral Evolutions in some depth over the last few years, and particularly at the early part of 2020, when we did a full report on this. I think it is important to recognise a couple of things when we're talking about this service. And the first one is that what is not at issue is the quality of the services delivered. I think there's general recognition that those who receive the service are getting a very good service. And also, very importantly, that any discussion about the future of day service will, we know, inevitably lead to a high degree of stress and concern by those people who use the services, and also their parents and carers. And I'm sure that all the members on this committee are very conscious of that in the discussions that we have. But nevertheless, there are some areas here that we can't shy away from. And having been on this committee for a long time, I do know that when Wirral Evolutions took over the day services, it was done on the basis that they would develop an offer and that was attractive and that would generate some income. Or produce a saving, certainly that they would manage within the cost that they were given, and that really doesn't seem to have happened to date. Now, I think we probably all will have had some correspondence from very concerned relatives and carers. And one of the points that was made was that it's not fair of the council to describe, and actually a misrepresentation, to describe the funding gap of 500,000 as an overspend. I wonder if you could just give us the detail and background to that 500,000. And also that inadequate consideration has been given over time to uplifting the amount of money involved in this contract for things like the introduction of the real living wage, which we were keen to bring in as a council. So I wonder if you can address those points. There is also an issue which I'd like you to look to, if you don't mind, about the speed of any changes or reforms or review. And I know that a lot of carers would prefer this to be done as a long-term programme, whereas you may have a different view from that. So if you could address those issues, if you don't mind. Thank you.
Thank you, Councillor McLaughlin. So first thing for me to say is that Wirral Evolutions is a company, and from the perspective of this committee, what we do is we contract social care services with a number of organisations. Wirral Evolutions is one of those organisations. The money that we have in the budget is 5.01 million. The budget is 5.01 million. The cost of delivery with Wirral Evolutions is over that. And that's for a number of reasons. And primarily that's the business of Wirral Evolutions as to why it costs them more. We have worked very closely over that 5-year period with Evolutions to show how the funding of Evolutions has changed over a period of time, and what elected members will see there is that there have been annual uplifts in the budget. Those annual uplifts haven't necessarily kept in line with costs. The difficulty we've got as a council is that we can be seen here to be subsidising our own business at a higher level than we would be with the, if you like, the care sector out there. So that's an issue for us as a council. The reason this is represented as an overspend is because the business is costing more than the contract value that we've got available to us as a committee. So in essence, what we're seeing is a company that is available to it. Now, if that were another company, that wouldn't be a problem because they would have other activities. They would be perhaps borrow to tide them over. They would have investments. They would have a certain capital value underneath them that allows them to ride out over time. The difficulty we've got with Evolutions is that those plans haven't been made. So the only thing we've been able to do is spend over the value that we've got within the social care budget, and therefore pay out more, if you like, than's available to social care for Wirral Evolutions. So then it's become a pressure in the social care budget, which is then reported. I think it's not a misrepresentation, this is overspend, because that is the contract value that we've set as a council. And that is the target that Wirral Evolutions has to deliver to. The decision this evening is primarily whether elected members accept that Wirral Evolutions will now develop plans to deliver that saving. That does come to the issue about the speed of delivery and reform. The council, as all elected members are only too aware, has been having to make some very hard decisions about its budget going forward. And within that, there are some quite challenging changes that need to be made to services. The decision around Wirral Evolutions is made in that context. We don't have the leisure of being able to say, actually, we can take this budget saving over a much longer period of time. Should we agree to take the 500k this evening, then it does need to be, should it be agreed within the council budget setting process in March, the budget for social care is set with the 500k target for Wirral Evolutions, then it does need to be delivered within the financial year. Now the company will have decisions to make in terms of how it does that and what timetable it takes to do that. It will be responsible for the plan, and it will be responsible for the consultation with users of the service about specifically how it comes into line with the contract value that's available to it. So a lot of the work that we've talked about, a lot of the people that use the service, working sensitively with carers, will be very much the responsibility of the company to do. And like it would be with any other company that we work with out in the social care sector. I hope that covers the issues raised.
Thanks, Chair, and thanks to you, Graham. I take your point that about what we're being asked to do on the recommendations of this report. Also, that I note in paragraph 1.2 that Wirral Evolutions have submitted a proposal to the council to bring the operating costs back within line of the contract value. So thanks for the information, Graham.
Thank you. Councillor Gilchrist, then Councillor Berry, and Councillor Cannon.
Graham has clarified the issue that the financial matter eventually rests with policy and resources. What this recommendation we have, if we approve it tonight, I hope purity, so that there isn't speculation about who will be running the service. And it does mean, if we pass this resolution as I read it, that carers and service users would not have that anxiety about someone else taking it over. And I think I got the point that the present management of the company have an opportunity to come back to us in clause 3 about their progress. I merely would ask about this question of quarterly or 6 month, the reports, is that when we have our committee calendars for next year, when that's worked out, that it is dovetailed in with those so that the reporting periods enable it to come to us in a timely manner. So we're not weeks behind, or we're not short of information at the crucial moment. Thank you, Chair.
Okay, thank you. Yes, Councillor Berry, then Councillor Callan, then Councillor Burgess-Joyce.
Thank you, Chair. Thanks, Graham. Just a couple of questions, if I may. On the documentation on reasons for recommendations, on item 1.2, it says Wirral Evolutions have submitted a proposal to the council to bring the operating costs back in line with the contract value, which the council supports as part of the budget consultation process. On the next section, 1.3, it goes on to say there has been a significant shift building-based day services towards more sophisticated, personalised community-based day opportunities, which offer more activities in settings such as workplaces, colleges, sports and leisure centres and community centres, or local hubs based within local communities. This in turn can enable people to develop more independent skills. Could you just enlarge on that, Graham? I take it that you've been, that the talks that you've had with Wirral Evolutions, and I believe they started last year because this was part of the budget cuts from last year. You've obviously had conversations with them. Could you just enlighten us as to what the alternative provision would look like for the service users? And one other thing as well, the length of the contract, be a 12-month contract. We're going to find ourselves in the same situation in a few months' time, and this will bring extra anxiety to the, not only to the users, to the service users, but to the parents and carers. Could we not have a longer contract, a 4-year contract that could give the carers and parents some peace of mind? Thank you.
Thank you, Councillor Berry. In terms of the paragraphs specifically mentioned there, then Councillor Berry, the intention there is to highlight that the modernisation of Wirral services is quite far behind those of other areas where there are lots of day opportunities available in other like-sized local authorities, and that in essence, the key aim of learning disability day services is to enable people to maximise their lives, to get independent living skills, and ideally to be able to get those skills to live in their own home and to have a job. For Wirral Evolutions, we do have a very large number of people that are supported within traditional day service buildings, and that is, as a comparator to other areas, that is where we are different, and of course that also costs more money. So I absolutely understand, Councillor Berry, that from a carer's perspective, change is frightening, and moving to a new type of model can be very scary. Having said that, the new management at Wirral Evolutions, the managing director, has been working closely with carers and to discuss with them what those new opportunities might look like, how they will focus as a service. For example, the employment support offer is underdeveloped within Wirral Evolutions. That kind of skills focus with people is underdeveloped. What they'd like to do as part of their focus on consolidating their services so that they have groups of people with similar needs together in particular types of service in those services on those needs. So for example, They were looking some time ago at development in the Liso area alongside the Liso Leisure Centre. So for an active group of service users that are very interested in sports, their health and well-being, that would be a very good offer. But other parts of the service need to focus on employment skills, and other parts of the service need to focus on that kind of direct care and well-being for those people with the highest levels of needs. So it will mean they look at both their staffing and their building stock in terms of the skill set and in terms of how they provide that service. But they would be working very closely with carers, with families, in terms of developing those plans further.
Thank you.
Thank you, Greg. Could you just answer the point on the contract length, please?
Oh, yeah. So in terms of the contract length, in essence, this committee can decide whatever contract length it wants. The reason we've recommended a year concerns that came through the scrutiny committee in relation to the ongoing issues with Wirral Evolutions. We would need to be able to take action should the contract not be delivered within the contract value, and that there's a cost. The other concerns about Wirral Evolutions, although they weren't about the quality of the service, were about the transparency of the company, and all of those issues also need to be dealt with within this next period. So I think the issue is that the one-year contract is more about Wirral Evolutions than it is about the business model than it is about service continuity. But that is a decision for the committee.
Thank you. Thanks, Greg.
Okay, thank you very much. Councillor Cannon.
Yeah, thank you, and thanks, Graham. I think just building on what a few other councillors have would be done, and I'm assuming that they have either been done or they're ongoing, because we agreed that at scrutiny to make sure that we were actually delivering the service and the care that we needed to the individuals, because I remember him saying that some of them were slightly outdated just simply because of sort of gaining access or just sort of working relationships. So it was just those two things, please, Graham.
Thank you, Councillor Cannon. So in relation to the first element, I hold a board of the council, and the shareholder board is the place where senior officers and members look at the company and the working of the company. Now, there is a wall intentionally separating the business of the company and the business of the commissioner. And we as a committee are commissioning the service as opposed to the company. So I'm not able to bring here, and actually when we were working on this this report, we had to be very careful that this was about the award of the contract rather than the business of the company. Now, elected members may continue to have concerns about that, and I do know that the due to work with the company in relation to that transparency and in relation to their viability and sustainability as a company. That we're unable to go into too much detail here about that. I'm sorry to say. In relation to the care, is very keen to move forward with a more modern service that's better fit to the needs of individuals, the business of this committee as well, so that when we are receiving those reports from Evolutions, I think it's going to be really important for elected members to to be kept in the loop in relation to how that's progressing, and to receive feedback from people in terms of their views on the service being provided by Evolutions going forwards.
Thank you. Thank you, Graham. I've got Councillor Burgess-Joyce, then Councillor Jordan, then Councillor Collins.
Thank you, Chair. Good evening, Graham. I'm conscious around some of the commercial sensitivities, and I fully understand. I had my own sort of issues probably back in 2015 when it was set up, and I think it's set up as a LATCO. I think that's terminology that we use these days. But I'm just conscious, two quick questions really. Is there anything else that we can sort of squeeze out of shared services to support them? And I'm conscious again about that divide of commercial responsibility that they have. And I suppose the second point is, if at some point, because they're a limited company, they were to fail as a result of our actions, would we then really have to bring that back in-house anyway, as a matter of course? So I appreciate that second question might be one that you're uncomfortable answering, but it's one for colleagues to know that, you know, it is a limited company, and by our actions we could actually denigrate its ability to deliver the service back to us. So it was that, Graham, really, if you could answer those. Appreciate that. Thank you. Thanks, Chair.
Thank you, Councillor Burgess-Joyce. I'm going to have to be quite circumspect in relation to how I answer that question, because you're absolutely right. It was set up as a LATCO, and they are, you know, in many ways an independent company. However, the shareholder board, which is chaired by the chief executive, does have responsibility to assure itself that the company is effective and that it is sustainable, and that is why in that shareholder board they need to look at those. I am absolutely sure that we could support them, you know, with greater levels of back office support. There are some elements where Evolutions gets that support separately, and we probably need to consider as a council whether there's enough director level input into the company. That clearly wouldn't come from someone like myself, because you know, clearly we're here talking about the contract, and the contract could go elsewhere or whatever, but there is an issue about whether there is sufficient support from a council perspective going into the service.
Thanks,
Thank
Graham.
you.
Thanks, Chair. Thank you.
Thanks, Graham. Can I just ask that somebody tries to get Councillor Cannon back into the meeting? She's struggling now to get back in. Right, Councillor Jordan, then Councillor Collins.
Thank you, Chair.
Remind members of the time.
Pardon?
So can I just remind members of the time?
Yes, okay. I'll try and be quick. I think there's probably nothing worse, Graham, than sitting around the edge of a room, if you're, be it a care home or be it a centre for people who have learning disabilities. So I'm all for seeing individual assessments to enable people to develop their living skills and go on to do some sort of meaningful employment. My concern is for those who will never get to that stage. And I think most of us as members have had our inboxes full from parents and carers who are worried about their children, their nieces, nephews, whoever they might be, who are in this particular category. I haven't had one email about somebody who might be able to be employed in something, because we all think that's great, that would be amazing if we could enable people to fulfill their potential. But the concern that people have and that they express all the time is people who really are at the end of there's no way they could cope 24/7 looking after these kids that they've got. And when I say kids, they might be their children of age 50, but they need some help every single day. And those are people we are concerned about. And so my question is around those people and what happens for them going forward.
Thank you, Councillor Jordan. And it's a very important question raised by the carers regularly. The demographic that we're talking about is primarily an older group of people with learning disabilities, many of whom have gone to day services for a number of years, for how much progress individuals can make and have made. And Evolutions themselves have shown that through some of the work they've done through the leisure offer, and also some of the work that they've done both in relation to cohort of people that will continue to need personal care, a relatively high level of personal care, and those people will of course be catered for within the future model for Evolutions, as well as those people that can be developed. My argument would be that everybody can be supported to have a higher level of independence, even if that just means they're able to direct their own support a bit more and how that support is around them. But I just want to be absolutely clear that we are not talking about a model where we stop providing day services for everyone and people are then hanging around cafeterias all day and that type of thing. That is not what we're on about. The modernisation of Wirral Evolutions will look at all of those sets of people, and yes, a key part of that will be about trying to support people to be more independent, but it will also be about making sure that that personal care and support where it's required continues. They've managed really well through COVID, and they've a lot of outreach support directly into families. And but there has been way through a cohort of people that have needed to continue to go into a service, but it's vastly less than the whole service that's there at the moment. So it's not everybody. It's a much smaller cohort of people. And of course, we should also remember that quite a lot of our support in the community and supported living or other alternatives. So a percentage do live at home with their parents, but not everybody. I hope that answers the question.
It's to do with the recommendations. I don't have any major concerns except for the first recommendation. Is that we've been talking a lot that Wirral Evolutions is a business, it's a limited company and everything else. If they're a limited company and a business, they're able to go out to the marketplace for all their back office services. I believe, now I may be wrong, but I believe there's a clause in the contract that they must take certain services from the council. That's what I was trying to get at before, Graham. Is that true? Because if so, I do have a recommendation.
Yes, that is true, and that's covered by a buyback clause. That is fully funded. Should there be a decision that they don't need to buy back from the council, then that would have to be reconsidered in terms of the costing and the value of that's in the contract.
So just to make it clear that any money that they give to the council for services, it's already been to them, so that they would actually potentially lose that if they decide to go out to the marketplace.
Precisely, or that they'll be reconsidered based on the marketplace cost.
Thank you for that. Thank you.
Thank you. Councillor Jordan, you've still got your hand up. Is that just a legacy, or did you have something else to add? Okay, thank you. I can't see any other hands. If anybody else has got a hand up that I've missed, please shout. Otherwise, thank you very much, Graham, for that report. The recommendations are there. Are we moving them all together? Is the intention, Graham, that they're all of a piece, or are they separate?
The intention is that they are all of a piece. However,
all of a piece.
Yeah.
Okay, that's fine. I just want to be sure. So, do I have anyone to move those three recommendations?
I propose those, Chair.
I'll second that, Chair.
Councillor Usher, thank you, and Councillor Collins, thank you very much. We take that by assent, unless people want to vote. Right, thank you very much. Thank you for that. And now we move on to what is now item 8, which is the future safeguarding arrangements. So, Jason, you let's take a breather, Graham. This is Jason now.
Thank you, Chair, and good evening, councillors. So, local authorities all have a duty to have a Safeguarding Adults Board, and that duty is described in the Care Act 2014. The way Wirral currently arranges its Safeguarding Adults Board arrangements is by way of the Merseyside Safeguarding Adults Board, and that comprises Wirral, Liverpool, Sefton and Knowsley local authorities. That arrangement came into place in to establish a local Safeguarding Adults Board in each of the local areas. So the recommendations are that committee are asked to agree in principle that a local Wirral Safeguarding Adults Board be established to fulfil those statutory requirements that are currently met by the Merseyside Safeguarding Adult Board arrangements. And also committee are asked to receive a further report at a future meeting to outline the plans for the local arrangements for our local Safeguarding Adult Board arrangements. Other plans here. So there was an opportunity to discuss with any of those local authorities in the current arrangements as to whether we wanted to join up, and there was potentially 2 local authorities that could form some arrangement, but that didn't really achieve the benefits of current arrangements or maximise the opportunities of a local arrangement. Another opportunity was to have a hybrid model. Some of the functions of a safeguarding board continue on the Merseyside Safeguarding Adult Board footprint, and others were arranged locally, but that wasn't the most efficient way to do things, and it doesn't give us the maximum opportunity to make correct connections and arrangements locally. The decision that influenced members of the current arrangements to change largely came from a peer review that was undertaken by the Local Government Association, and that peer review found some real positives and some really good work and outcomes from the current board, but it also asked the board to seriously question its strategic fit with partner organisations and the additionality that the current arrangement brings, and that did lead some of the members to consider and to put in place more local arrangements. If we establish a board locally as a Wirral Safeguarding Adult Board, that would afford us more opportunity to strengthen the links with the domestic abuse strategy and those services around domestic abuse support of people affected, and also with Channel Panel, Prevent, and importantly with the Children's Safeguarding Board arrangements, so that we can take a more whole family approach. So those opportunities could be significantly strengthened. So committee are asked to consider the recommendations of establishing a local board arrangement and for a further report to come to a future meeting. Happy to take any questions, Chair.
Thank you, Jason. Councillor McLaughlin.
Thanks, Jason. There's a couple of things. First of all, I'm pleased to see that it gives the opportunity for closer links with domestic abuse and Prevent, etc. But having attended in the past the local safeguarding board as an observer on a few occasions, said was that financing of it was a problem, and that not all the partner organisations were prepared to put in the necessary finance to make it function effectively. there is no figure attached to stepping down the regional and becoming a local one again, a Wirral one again. But there obviously is a figure, but it's not contained within the report. That's the first thing I'd like to say. And the other thing is an observation as well, is that you talked about moving closer links with adults and seeing it as a whole family, and I agree that is probably the way to look at safeguarding issues. However, my perception or observation in past times was that when there was a closer link, I think it was one safeguarding board, wasn't it? Children and adults were combined. The adults kind of slipped off the side sometimes. We didn't get very much information about domestic abuse that related to financial issues around for older people or that kind of thing. It tended to look in a different direction sometimes. Just your thoughts on that, please, Jason.
Yeah, thank you, Councillor McLaughlin. Yeah, so the proposal isn't to set up necessarily a joint board for children and adults, but really to strengthen the links. I think that has been harder to do across the Merseyside Safeguarding Adults Board arrangements. There is a statutory requirement to have an adults, specifically an adults safeguarding board, and of course safeguarding for adults is on the same legal footing as children's now under the Care Act. So it's absolutely right that whatever arrangements we put in place, we must ensure that we've got a strong focus on the requirements and the benefits of having an adults board as an element of our local arrangements. In terms of cost and efficiencies around this, it's true to say that we did achieve some additional income through our Merseyside arrangements across the 4 local authorities. And of course, it was efficient for some of the partners, such as the police and fire services and so on, that were only attending one board. The model that we arrive at, and subject to a future report coming to this committee for discussion and approval, the model would detail what the costs would be and what potential income would be. We would still expect some income to support the work of the board, because it is a partnership responsibility and not just a local authority responsibility. But that is to be defined and to be worked up depending on how we configure it. I do just want to draw committees members' attention to the staffing costs. The staff that currently work in the safeguarding unit that support the board are actually Wirral employees, and they will remain Wirral employees, and their post will not be affected in terms of being at risk from this proposal. And those staff will be available to support the functions of a local board, however we set that up. So I hope that answers partly your question, Councillor McLaughlin.
Yeah, thanks, Jason. I think it's we'll see how things develop. Thank you.
Thank you, Jason. Yes, I think it's true. There will have to be a fair bit of work done to persuade to encourage and persuade our partners, our statutory partners who have to be there, health and police in particular, to financially support the board. But there's quite a lot of other potential partners as well who can, if they're worked on, and I'm sure that'll be the job that yourself and Paul will be doing. We've got that level of cooperation from partners, because we certainly have it around, all right, we haven't asked them to put their hands in their pockets around domestic abuse, but the level of involvement we managed to get around that, hopefully if we could get that around an adult safeguarding board, it would be excellent. Councillor Green.
Excuse me. Yes, thank you, Chair. Yeah, Jason, clearly, I think we would all, the sense of local is good and so on, and can have a more direct impact, one presumes, as opposed to having to look at the entirety of Merseyside or the city region. However, it seems a bit odd that if we've had a peer review and the peer review says the system we've got is, has all these positive points you referred to, and yet it suggests breaking it up and going into local. So one presumes, and I did try and read the full report. It was a very full report and not filled with lots of words I wouldn't necessarily fully understand. But were there any weaknesses that were identified? So the longer we carry on with this continued arrangement, there are potentially people that are at risk and are doing the best we could for them. And were there any other weaknesses that were identified that we now need to make sure, given we're going to have the same staff, from what you suggested, we need to make sure that those weaknesses, those gaps are plugged. I am speaking from experience, as Graham will know, of a person I know, a family member actually, that did have a safeguarding, an elderly person had a safeguarding report carried out because of issues with with public services and the way they didn't look after that person. So in terms of that, are there some weaknesses in the current system that we have an opportunity?
Either of the failings, either of the current board arrangements, or of safeguarding practice across any of the local authorities. What it did do is identify clarity in some of the areas and some of the functions. So some of the subgroups, for example, I think was raised in the peer review, in terms of being very clear about what the output of those subgroups would be and how they can improve monitoring and good practice improvements across the board. I think the factor from the peer review that led to decisions from some local authority members was that there was a lack of clarity as to what the additionality and benefits and what the combined board could do over and above what local board arrangements could do. And so some clarity needed around the strategic fit with some of the partners and strategic aims of the boards. So I don't think it identified failings in any specific sense, and also I don't think it specifically advised or recommended that the boards should be funded either. But it did prompt local authorities to review their needs as local authorities, and it was individual local authority decisions that were made to review the future of the board and to express a will to step it down.
Thank you. Thank you very much, Jason. Graham, you wanted to contribute? Can I just say as well that I have been asked by committee services for us to take a short adjournment after this item because the webcast is running slow and they would like the opportunity to fix it, so we'll just have 5 minutes.
Liverpool and Sefton have both had a new DAS during this period, and actually during the period that review was undertaken. In both of those areas, they'd had conversations with the elected members, and those elected members felt that they would prefer, and it wasn't after the review, it was actually before the review was undertaken, they would prefer to develop localised arrangements. So notice to a degree has been given by both Liverpool and Sefton in relation to the current arrangement. So it does mean that in many ways that this is about elected members saying actually we would prefer a more localised response as opposed to the Liverpool City region. Of course, from our perspective, Wirral couldn't just remain in a partnership with just Knowsley. So that's, I think, part of the background in terms of why we need to develop those localised arrangements, more so than actually what was in the peer review.
Thank you. Thanks very much for that, Graham, and I wholeheartedly support the idea of board being local to Wirral, especially as we're now, as previous item, moving into much closer working with our health colleagues in terms of our integrated care services. I would really do welcome that our safeguarding arrangements are going to be local and focused just on Wirral. It's plenty big enough as an area to have its own safeguard. In fact, local authorities far smaller than Wirral have their own safeguarding boards. So I personally welcome it. Cllr Usher.
Thanks, Chair. Just wanted to make a few comments. I'm sure these conversations have already been taking place, and I'm sure they'll continue to take place. But the Chair, Councillor Nolan, outlined some of the practical difficulties about getting a local safeguarding arrangement up and running when you're having to consider how it will be funded and who will do the funding. So I think there's definitely some conversations to be had with colleagues in children's services who have probably in the last few years gone through quite a similar journey. Firstly, after 2016, where the local Safeguarding Children's Board went through some significant rearrangements, and secondly, in September of 2019, when there was a transition between the prior arrangement of a local Safeguarding Children's Board towards a multi-agency safeguarding arrangement. And there's definitely some learning there, and that may prove useful for the board. Colleagues who are experienced in this, David Robbins and Professor Maggie Atkinson, who may be able to shed some light on how those conversations of encouragement and persuasion can take place. So I understand that there's a huge amount of difference, and that the children's position has been backed up by a change in legislation when it transitioned into the multi-agency safeguarding arrangement. But nonetheless, they've done some significant work about bringing partners into these arrangements to a greater extent. So I'm hoping that those conversations are taking place, and it could potentially.
Right, in the absence of any more hands, we will. Okay, so 5 minutes. We are currently at 20. Thank you, and welcome back, everybody, after our short adjournment. I'm told that our technical gremlins have now been dealt with. I've got two hands up already, Cllr Usher and Councillor McLaughlin. Start with Cllr Usher and then Councillor McLaughlin.
Sorry, Chair, that was
a legacy hand. Right.
Mine also.
Yours also, right? Okay. I did think, goodness me, they've been thinking of questions during the adjournment. I do know I've had a message from Cllr Usher just to confirm with you, Graham, or Jason, one of you, that conversations with partners around setting up the Adults Safeguarding Board, or should I say the Safeguarding Adults Board, are underway. Could one of you just confirm that, please?
Thank you, Chair. Yes, they're underway.
Okay, thank you very much. Right, so we are now on to the Extra Care Housing Capital Report, and that's now item 9. It's the second part of that, what was item 8, which I've now moved to the end of the agenda, which is the exempt item. So, Extra Care Housing Capital Report, Simon Garner's going to take us through that one. Simon.
Good evening, Chair, and good evening, members of the committee. I'm going to talk to you briefly about what this proposed development is, why it's needed, and just some conditions around it that we need to be aware of in terms of considering the recommendations within this report. So this is a further development of extra care housing. Extra care housing that is designed to meet the needs of people with a eligible Care Act need, and the provision of 24-hour care that's on site, round-the-clock care that's on site. We have a number of these schemes already existing in Wirral, as members are no doubt aware, and we have a number of schemes in development currently, which will add to the overall numbers that we have. The benefits, of course, is for many, it's a popular choice, providing accommodation with care that reduces the need for residential or nursing care. And in that respect, it obviously does a lot to maintain people independently in the community for as long as is possible. A former plan, Wirral plan that we had, set a target of 300 additional units by 2020, and we haven't reached that target. Part of that is to do with government policy causing delays, and we have reported on that previously. But we have achieved 101 new units since we embarked on this particular journey with this target. We have a further 2 more developments, Rock Ferry, which is 101 units, and Poppy Fields, which is 78, which will bring us up to 281 in the next 2 years. So it is still our aim to deliver on what we started, albeit delayed, and this latest proposal will certainly help us to get there. It's a total financial cost, as you can see in section 3.3, 15.156 million, of which the contribution that is needed is 3.586 million. This is at a time when state aid rules have been revised, and we will need to, as a consequence, revisit eligibility here. So the timing is not perfect. However, it is important in terms of making sure that this remains an option to consider this development. As ever with these developments, there will be a legal and nominations agreement to any grant that is awarded to the scheme. But in order for the scheme to actually progress with a planning application around July of this year, it would need state aid grant from the council. Thank you, Chair. I'll take any questions.
Yeah. Comments for Simon? Councillor Gilchrist.
Thank you. Not so much a question, but a mixture of observations and thoughts. Because near to me there's Mendel Court, and years ago we had established scheme in Poulton in Wallasey with Housing 21. What I'm always fascinated by is the pipeline. And by that, I mean it takes years to find a site and years to get something in place. At various times we've been knocked off course because of changes to the rules. The report suggests a need continuing right through to the year 2035. Now, whilst that's looking at a number of people in a certain age group perhaps, I'm wondering how, as a committee, thinking about investing to save, we could think about years ahead as well, so that we don't keep stopping and starting, but have, I know Belong's coming on stream at some point or other, but we have a flow that helps us meet a need in particular communities as we identify them. And that would mean finding sites, putting capital aside and talking especially to Homes England as well. But I'd be grateful for members' thoughts on that. Thank you, Chair.
Thank you, Councillor Gilchrist. Do you want to comment on that, Simon? Anybody else want to comment?
Yes.
My only comment, sorry, before you start, my only comment on that, Phil, is absolutely an ongoing planned programme with agreement with our our housing partners is the ideal. And also, but that's also dependent on us being able to forecast accurately need and forecast exactly, not exactly, but fairly closely what we anticipate demand is going to be realistically. Because it isn't just for extra care housing for older people, it's also important for other groups as well. So I don't know if you've got any other comments, Simon.
We've been actively involved, obviously, with the council's support needs analysis completed. That has clearly has done some significant work around the needs of the council of Wirral going forward in terms of extra care and other types of specialist housing. So it does give us, because that's been a wide public consultation and survey, that does give us some stronger evidence about what we need going forward. But I agree with Councillor Gilchrist, it's getting something more regular set up so that we have more of an annual event of actually checking where people are and what people will engage with in the future in terms of this type of housing, so that we're tighter on the numbers going forward and can plan well ahead. We do have more than this development in the pipe. Housing developments are at a much earlier stage and not at a stage where we're looking at grant funding.
Thank you. Thanks, Simon. Any other comments? No? Okay, in which case, well, thanks, Simon, very much. And can we be clear that we have someone to move the recommendations, which is that we authorise payment of a grant of up to 3.685.4 million to Housing 21 from the Extra Care Capital Programme, and that we note that we will have nomination rights for units that will be provided.
I'd be happy to do that, Chair, if no one's jumped in first.
Well, thank you, Councillor Gilchrist. Any seconder? Councillor Cottier.
Yep.
Okay, in which case, thank you very much, Simon. And we will now move on to...
Chair, if I could just say, sorry if the issue with the webcast distracted me, but did we formally move and second the recommendation in relation to the safeguarding board? I think we might have been thinking about having our adjournment because of the webcasting issue. Maybe we just forgot to deal with that formality, but I think members did agree it by assent.
We did agree it by assent. Mover and seconder. Safeguarding board.
I'll move it, Chair.
Thank you. Thank you, Councillor McLaughlin. Seconder.
Happy to second.
Thank you, Councillor Jordan. So that's done now, Vicky. So we've dotted the I's. And we've agreed extra care housing capital. Well, nobody's objected. So again, take that by assent. Right, then we move on to the budget consultation report, and that's back to you, Graham.
Thank you, Chair. The budget consultation report that we have on pages 321 to 328 is the paper of the Director of Resources. This paper forms part of the budget consultation process, which is in turn set out in the paper. As this committee will know, the council must have a budget recommended to it and to have the ability to set a budget by the 11th of March 2021. So this paper invites committee to comment upon and provide feedback regarding the proposals for 2021 that form part of the public consultation. in order that these comments can be considered by P&R committee in February. Now, specifically for this committee, the proposal that has gone to public consultation, there are other proposals, but they didn't need to be consulted on, is in relation to Wirral Evolution's £500,000. And clearly that was referred to in the Wirral Evolution's report that we looked at earlier on, but this is specifically in relation to the budget consultation. Thank you, Chair.
Thank you. Does anybody have comments, feedback? In respect to that, we've already had a good discussion around it, but is there anything in particular that people want to feedback to Policy and Resources at this stage?
Chair, I think that we, excuse me for interrupting there, I think that we did submit a report early on in the process, which contained our thoughts after the work we'd done looking at the detail of this. I've got anything to add, and in fact I prefer not to add at this point because we will be looking at them again when consultation is over.
I would support that. That's exactly my thoughts as we were looking at this, is that I don't see any reason to change the recommendation that was actually moved at the committee previously. I think by recollection it was moved by Councillor Cannon, and I see no reason why we would do anything different to that. I think that can, as far as I'm concerned, that can be our feedback, and that can go to Policy and Resources. Councillor Usher, you've got a comment on that?
Just to agree, Chair. Just to agree that obviously the consultation is still sort of ongoing, so we're best to wait until that's concluded and see exactly what the feedback from that is.
So what we're suggesting then is that we're being asked to comment and provide feedback, and I think that our comment and feedback will be that we are still of the view that we were at whatever, was it the November committee? This committee is still of the same view and agrees with the recommendations that were made at that committee. Sees no reason to change those. People happy with that?
Agreed.
Agreed.
Right, thank you. Then, so in that case, then that's our recommendation. Hopefully somebody got the wording of that. And then we move on to item 11, which is the revenue budget monitoring. You again, Graham.
Thank you, Chair. So the revenue budget monitoring report is a standard revenue report that will come each time this committee meets. This particular report covers Q2 of 2020. That's April to September. Clearly, the context of this report is in relation to ongoing COVID positive crisis and related issues in relation to cost. The report does indicate a projected underspend of £600,000, which may well surprise members of the committee. That's because during the first stages of COVID-19, certainly during the first wave, we did see a reduction in demand for service provision for social care. And of course, we also were able to charge the NHS for a number of costs, such as the packages of care for people leaving the hospital and those types of things. So all of that did help. Having said all of that, there are a number of other factors to consider in relation to this report. There is a challenging cost effectiveness target for 2020, which includes significant levels of review, and delivery of those costs is taken into account. Delivery of those savings is taken into account here. So it is likely that the figure will change through later quarters. As I said earlier, we did see reduced demand in the first quarter of 2020. However, the demand has returned and additional costs are being incurred, particularly for people who have needed additional support. But that does continue to be partially offset by NHS funding and also by government funding in relation to dealing with the infection and prevention control costs. And again, that supports the sector, but it also supports ourselves. Nevertheless, this is a very positive report in the context of the challenges that we face, and I'll just take any questions.
Any questions for Graham? I think my only comment is that I would like to have seen more current data, and we obviously don't yet have Q3 figures. And I also think that it's worth, certainly the spokes group, we meet regularly, considering whether we actually work as a budget monitoring panel on an ongoing basis, particularly going forward into this year with quite a challenging budget, one that we believe we can achieve, but it's certainly something that I would like to monitor on a regular basis to see where we are and if there's any slippage and what's happening, rather than have surprises. So we'll maybe have that discussion, see what the other spokes feel about that.
Yes, I like that idea. I think that would be helpful.
Okay.
Yes, yes, I'd agree it's helpful. I just hope that the back office systems will be able to get the information together for us, whether it's literally liquid logic or Excel spreadsheets or whatever the legacy from our ancient systems is. Thank you.
Yeah. Just to give assurance, Chair, I've absolutely heard what you've said in terms of the timeliness of reporting. Clearly, the Q2 report is in line with the corporate reporting mechanisms. More contemporary budget reporting information is available. The system that we use, Liquid Logic, is up to date, and Controc, which is the system that pays providers, again, is also up to date. So we are able to produce more contemporaneous information. So I think what I've taken away from your comments, Chair, is that this committee does need to be much more engaged with up-to-date through a budget monitoring process to be agreed.
Right, so I'm proposing then that this, I'm thanking Graham for his report and proposing that the committee agree that the party spokespeople will form a budget monitoring panel that will meet, I suggest, monthly to look at current data as close as possible to real time, and with a view to particularly related to the savings that we're attempting to achieve and our progress towards achieving them. That's what I'm proposing. Can we take that by assent?
Yes, by assent.
Yeah, agreed. Okay.
Yes, agree, yeah.
Right, thank you all very much. And the recommendation was to note that report from so is that agreed? Comments? Yeah. Agreed. Thank you very much. Noted projected revenue. Thank you very much. Now we come to item 12, the performance report. Graham. No, it's not Graham, it's Jason, sorry.
Thank you, Chair. So this report's provide in relation to adult care and health services. Members have requested the report also comes monthly or to every committee rather than quarterly as was previous, a bit similar to the finance report. The recommendation is that committee members are requested to note the content of the report and to highlight any areas that require further clarification or action. The main body of the report, dated 9th of December 2020, is included at Appendix 1, and I'll just highlight a couple of areas for members, if I may. So on page 342 or 344 of the electronic pack, residential and nursing care recipients. So this is the familiar line graph at the top of page 344 electronic pack that shows that the numbers of people receiving long-term care home placements has remained very static, really, very stable in the context of increasing demographic growth, older people living longer with multiple conditions, and increased demand on services. So that represents a reduction in the number of new placements and overall a relatively stable care home population. We have seen, as Graham has alluded to, some fluctuation in the care market due to recent events with the pandemic situation, and this has affected the care home sector too. Which is quite a significant proportion of the care market. However, not all of those vacancies are actually available for people to move into because of issues around care homes being temporarily closed to new admissions, and that might be because of contractual issues, or it may be to do with COVID outbreaks, for example, and infection prevention control measures. But we have to. The other thing that I would highlight is that the levels of discharge, the occupancy levels of discharge to assess bed, expect it to be and what we would want it to be. There are a number of factors that can explain that, but again, it's a small number of care providers that provide these services, and we have had a significant number of closures for new admissions, again due to infection prevention control advice. We know that if there's a COVID outbreak, it's at least 28 days before a care setting can reopen, and in some cases that relates to units within a care home, and sometimes it's an entire care home. So that's under occupancy rate is an issue that we're keeping an eye on, and I would further just draw committee members' attention to the consistently high level of domiciliary care provision, which is around about 16,000 hours of domiciliary care delivered per week. I'm happy to take any questions that I'll do my best to answer now during the committee meeting, or alternatively, if I can provide further clarity to members later, I'm happy to do so.
I've got Councillor Frost and Councillor Gilchrist.
Thank you, Chair. Jason, thank you. Two thank yous for me, really. The quality of information presented in here, but also the amount of work I imagine goes into presenting it to us on a monthly basis is really greatly appreciated. So a big thank you on that front. I had 3 questions. You've covered one of them around the occupancy rate, so that was very helpful. My other 2 are around performances, particularly some of the, and then my second area is around safeguarding. But if I take the performance first, understandably, obviously, due to COVID, there's been a change in the ability to carry out inspections. And I think I had a concern definitely in terms of the heat map that you presented in terms of presence of care homes. I had some concerns around any of the care homes that were in inadequate status, and then I'd be keen to get an understanding from you of outside of being able to inspect in the normal fashion, those that are in requires improvement, which is quite a significant chunk. I think it was on page 344, 71 in that kind of amber state of requiring improvement. So would be appreciative if there's an update on what sort of virtual inspections have been taking place, or your concern level of those inadequate and requires improvements.
Thank you, Councillor Frost. We have got a quality improvement report for care homes a bit later on the agenda, but in essence, there is a difficulty in the quality improvement team, as we've previously discussed, and as you highlight, there's a difficulty in them getting into the care homes because of the restrictions, and particularly restrictions on people that it's not essential to enter. So the quality surveillance still happens, and we make use of those professionals that are still going into those care facilities. So although there are issues about all staff visiting care homes, there are essential professional visits still happening, for instance, district nursing, specialist health staff, etc. So the way it's managed is that there are surveillance meetings that take place that take into account all of the information that people have observed. CQC obviously have been doing some targeted work in care homes, although not a full inspection regime. So they've been working very closely with our quality team too. So it isn't the same, but the team has been doing the best it can and weighing up the risks between directly getting into care homes and monitoring the quality virtually and making use of those people that are entering the homes.
That's really encouraging, Jason. Thank you. We in our kind of pre-meetings discussing around different virtual ways that in-person inspections could be gotten around. So that's helpful to get a bit of an insight into what that looks like. Thank you. My second area, as I mentioned, you'd covered on occupancy rates. My third was just around the percentage of safeguarding inquiries. So I think we're down to page 356. Just jumping down to 356. Yeah, so there's a, I would imagine, obviously COVID-driven, there's a significant, across KPI 3, there's a significant chunk of red and amber there, according against your criteria. It'd be, I guess there's a question of, in terms of that percentage of safeguarding inquiries that aren't concluded in 28 days, does it put us outside our statutory requirements, and is there a plan of action in terms of dealing with that particular amber and red KPI?
Thank you, Councillor Frost. Yes, this measure is a locally agreed measure. There isn't a statutory requirement for all safeguarding in Section 42 investigations to be concluded within 28 days. It's generally good practice, of course, to conclude investigations as thoroughly and as quickly as possible. However, some investigations are very drawn out and require quite in-depth investigation, and quite often investigations from partners such as the police. So it is something that we keep a close eye on, but it isn't an area that necessarily indicates poor practice or something that we are overly concerned about, but we do monitor it carefully.
Thank you. Thank you, Jason. Sorry, Chair, just one follow-up. So helpful then to know that it's not an indicator that we as members should be necessarily worried about. Given that kind of trajectory of those numbers, then is there a cause in your mind of that kind of move towards amber and red? Is it COVID linked, or is there another factor behind it?
I think it's probably not the case that we can say it's directly COVID related. I think I would suggest that we would need to do some further work to understand what the reason is for that, and it may be that we do some case analysis on specific case examples to understand if there are some patterns or whether they're all separate and unique individual circumstances. But we could perhaps do a snapshot of a few cases, an identified number of cases, and see if there is any pattern and feedback to committee members.
That'd be really helpful, Jason. Perfect. Thank you very much. Thanks, Chair.
Thank you. Councillor Gilchrist, then Councillor Jordan, then Councillor Collins.
Thank you, Chair. Perhaps I'll just start with supported living, because looking at the columns, which is page 355, let Jason get there, I'm happy to start at 2017 and take my eye up columns to see that in much of the early years we seem to now have regularly 7,700 or so people in supported living, and going back to 2018 it was 7,300 or 7,400. So I can see trends in various things, and I think it's trends that interest me. On the issue of the CQC, I would come to that item later, but I think most see reports about certain homes. I know that the CQC have issued a report. I've been through recent CQC reports on their website, so I can see a whole batch came through after their pause, though they did go in for specific reasons. So I think Jason has, I hope, satisfied us all that there's a good enough link between the CQC and our staff, like a sort of good exchange of information and early warning, which is what I'm looking again at the number of clients receiving service on page 345 in residential and nursing care. I would take it that the figures can be distorted by the recent events of the last year or so, but as far as I can see, there appears to be some stability in the absolute numbers of people receiving care based on the graph. So we had a strategy some years ago, I think, of trying to reduce numbers in residential and nursing care and do more in the community. Now, maybe I haven't gone back far enough to see what it was 5 or 6 years ago, but we appear to have made progress, and progress seems to be stable. So I wonder if Jason is nodding and comment on those issues. Thank you.
Yes, thank you, Councillor Gilchrist. We have seen a sustained position now over a fair few months where we have increased activity in supporting people in their own homes and in the community, and fewer placements and stable numbers in long-term care home placements seem to bear out in the performance data. It is particularly unusual at the moment in terms of patterns of placements, because we're likely to see a further reduction in long-term care home placements in the next reporting period, I would estimate, because people are nervous about moving into care homes unless they absolutely have to because of issues related to COVID and so on. So it is quite an unstable position at the moment. There's a lot of discharges into short-term care placements, but there has been a slowdown in admissions to care homes, largely from the community for long-term care placements. But that pattern has been sustained over a period of time in terms of reducing long-term care home placements and more support in the community.
Good, that's what we're looking for. Councillor Collins, then Councillor Cottier. Oh, Councillor Jordan, you were first. Sorry, Mary.
Okay, thank you, Chair. Jason, I noticed from reading the report that we have in Wirral higher than the average number of care homes, the national average number anyway, and yet only one is rated as outstanding. I don't happen to think that's good enough. And I'm hoping that in the future, post-COVID era, we can do something about that. Because I think if we're hoping to send our nearest and dearest into these places to be looked after, and judging from the stories I've heard over the past year, I wouldn't send anybody in there. Thank you.
Thank you, Councillor Jordan. If I could just respond quickly, Chair. Yes, I agree. It is correct that we have a higher than average number of care home registrations and care home providers in Wirral. And I agree wholeheartedly that we all want to see an increase in quality and an increase in numbers rated outstanding and good. I believe we have seen a reduction in inadequate homes, but we still have a high number that require improvements and not enough in the outstanding and good. So I do agree, Councillor Jordan. We are committed to quality improvement. Our joint integrated health and care quality improvement team are constantly working away at this, and we hope that when we'll soon be able to get them back working in care homes, they will continue with the good work, and hopefully we'll see things improving.
Right, thank you, Jason.
Thanks, Jason.
Councillor Cottier, then Councillor Burgess-Joyce.
Sorry, Chair. Did you say me or Councillor Collins? My internet.
Councillor Collins, then Councillor Cottier, then Councillor Burgess-Joyce.
Thanks, Chair. Thanks for that, Jason. It's quite an in-depth report. But going back to what Councillor Frost and Councillor Jordan have said about the CQC ratings, I noticed there's been the CQC ratings have said that there's possibly homes being have been inspected multiple times. So do we have a list of the care homes and their rating today? So that's what I'd like to see, is what their rating is. And also, is there a reason, or is there a common denominator about why people have gone into requires improvement or inadequate? So really what I'm asking for really is a list of the care homes that require improvement or inadequate.
I'd like to speak to Boris Johnson, please. I'm sorry, he's quite a busy man, but quite a busy woman actually.
Sorry, does somebody need to be on mute?
Hello everyone.
Councillor McLaughlin, I think your mic's on.
Oh, that's better. Sorry about that.
Yes.
So start again. Yeah. I'd just like to know why care homes are in the categories of required or improvement or inadequate, and is there a common denominator? What category? Why they're in there? Is it to do with care, training, or what have you? So could we have that the reasons why? I know you can't give it today.
Thank you, Councillor Collins. Yes, so we do keep a live list of each care home and what its current rating is, and also we have the history of their ratings, because obviously they do change over time. So we can certainly provide that to members. I think we still circulate to members a kind of RAG-rated list of care homes that are suspended, care homes that remain open and their CQC status. So we can certainly share that with members. As to patterns, I would have to come back to committee members with that information. But there are various themes within the inspection reports from CQC, and it may be that one of the categories, which is well led, is something of a pattern that we have seen. Certainly I've seen that in some recent reports where homes have fallen into requires improvement, or have struggled to get out of requires improvement. There are aspects of the well led as part of the inspection that seems to account for, but I wouldn't like to say that definitively. I would like to offer perhaps to review and see what the main themes and patterns are, and to come back to committee members. I think that the term is safe and well led are the two key lines of inquiry that I'll be looking at in that regard.
I know in the past that this committee or the equivalent committee had members going out to visit care homes when we were allowed to. So I'd be asking whether it would be logical for us to have a task and finish group to set up to return to that practice, Chair.
Right, well, I have one view on it, and I know there are other members of this committee who have different views. But I have a view that's not the task of us as councillors to be going into people's homes, because regardless of whether it's a residential care home, it's still people's homes. There are inspectors, there are professionals who are going in, and whilst there might be one or two of us on this committee who would know exactly what we were looking for if we did go in, there are others who wouldn't and who would be going in purely just to have, look around, obviously with the best of intentions, but really my view is that's inappropriate. I'm aware that that's not the view of everybody else on this committee, so I do think it's something that we can discuss again in the committee, but it's pointless at the moment, Councillor Collins, because we can't anyway, and we're not likely to be able to go into care homes for some considerable time, and I think certainly once we can, I agree with you, we have to ask some very searching questions about why we've got this level of concern about our care homes, because clearly whatever we're doing in relation to QA of care homes may need review, and we may need to have a rethink. I will be very interested to see what proposals can come forward about how we do this and how we raise the quality of our care homes, but now is probably not a sensible time to do it. Councillor Burgess-Joyce.
Good evening, Jason. Thank you, Chair. Jason, as always, exceptionally good reporting. Just as a query, on page 351, which is the end reasons for people leaving the process, it does specifically talk about other reasons. Now, ordinarily, other reasons is a sort of catch-all for, half a dozen different items that potentially, we can't categorise amongst all the others. But you do have a lot of lists and reasons there, and yet other reason comes up as 639, which is quite a large number. I just wonder if you've got a feel for whether there's any pattern in some of those other reasons that we might be of use to the committee.
I tend to agree, Councillor Burgess-Joyce. I think the list is too long, isn't it, of meaningful outcomes. It would be more meaningful if it was a far shorter list. Yeah. So I can't, off the top of my head, say what's in that other category, but I do think it's worthy of a review of how we categorise those outcomes and report those, because I'm not sure it's meaningful in its current format.
No, it's not a criticism, Jason, at all. Far from it. It's just curious, I think, more than anything, really. Thanks, Jason. Thanks, Chair. Thank you.
Thank you. Right. So now I've got Councillor Cottier, Councillor Jordan, Councillor Collins, and Councillor McLaughlin.
Thank you, Chair, and thank you, Jason. I have to agree with my colleague, Councillor Frost. The report is much better than the earlier ones from my scrutiny days. Thank you. Going through all this data, and there's a lot to take in, and obviously with the spectre of COVID over all this data, is there any data around notifiable incidents, the reporting in numbers and the outcomes, so that could give us an idea, a comparison with pre-COVID days, as opposed to the current the reporting now under COVID, because obviously, as has just been alluded to, we can't get into, or CQC can't go into inspect, and this could be an idea, give us an idea of any issues that might be coming up. But is there any way of capturing that data to give us a comparison?
Thank you, Councillor Cottier. We don't routinely include that in the report, do we? But we do have a way of capturing care concerns through our liquid logic systems, and also obviously there are the formal statutory requirements for notifiable incidents to CQC in certain circumstances. We do collect that data and we do consider it in our monitoring arrangements of care quality providers, but I'm not sure that we do report it in a performance reporting way. It is something we could look at if members would be interested to see that. We could explore how we can present that data for consideration. Perhaps that's something.
It's another mechanism with the lack of available data and the lack of physical scrutiny. And if you could do that, I'd be much obliged. That would be brilliant. Thank you.
Thank you. We can certainly consider how we can make that information available. We do collect it, and we do have ways of reporting it internally. It's just how we can best present that. So I'll take that away and explore what we can do, Councillor Collins. Cottier.
Thank you. Councillor Cottier. Then I've got Councillor Burgess-Joyce. Is that a legacy hand?
Sorry, forgive me, Chair. I'll put that down. Right.
Yeah.
Thank you.
In my head, I have Councillor McLaughlin, I think. Next.
Thanks, Chair. It was just really, and I'll do it very briefly, to say that we did have a notice of motion to council a couple of years ago, which made it a requirement that we set up a panel of elected members to visit care homes. But when we actually came to do it, it was done under the guidance, supervision and training of Healthwatch, and each visit was made accompanied by somebody from Healthwatch on one of their interim view visits. So we at no point did we say that it was councillors should go off and do visits, as most councillors are really not equipped to know what to look for. I take on board the points that you make, Chair, about your views. I'm not quite so sure I agree with those, but nevertheless I certainly do think that it's not right for councillors to set themselves up as some sort of experts as to what should be looking for in homes. And if we are going to do things, resurrect this panel, it should be done at a time when it's safe to do it, of course, but also under the same rules as we did it last time.
Thanks for that. That's helpful, Councillor McLaughlin. Right, we appear to have finally run out of hands. Yes, we have. So that remains to thank you, Jason, for that report. I mean, I have to say the improvement in quality of the data we're getting just gets better and better. Each committee, quite how you're going to top this, I'm not sure. But with the wonderful new system, hopefully we will. So thank you very much indeed. Oh, you're on next as well. So can somebody move that we note that report, please?
I'll move that.
Thank you. Thank you very much. And seconder?
Happy to second, Chair.
Right, thank you. So that's all we needed to do. So we've done the next two items, and we're now on to Julie, COVID response.
Yes, thank you, Chair. So,
Are you still awake, Julie?
I'm still here. So thank you, Chair. As you will be aware, since I last spoke to you on the 19th of November, we've entered our third national lockdown due to the increase of COVID cases both across the country and here in Wirral. This report provides you with an update on our outbreak plan that was published in June 2020 and updated in December. Within the report, we talk about to live with COVID and to manage outbreaks. Obviously, at the moment, our main focus is around the lockdown, but we're continuing to work in the background to make sure that we've got the various elements in place to help us when we exit lockdown. I'm just going to pick up a couple of points from the report, Chair, because I know it's very late and there are a number of other items still to be discussed by the committee.
Don't worry, Julie.
Okay.
I warn members that they need to bring bushels and flasks to this meeting.
Okay. And just very briefly going to talk about surveillance. We publish weekly data on the Wirral Council website. I know I've certainly been on tonight to make sure that it's there. That report is really telling us that we've got widespread community transmission within the borough. The majority of our cases are in the 20 to 59-year-old age group, particularly 20 to 29. That's where the majority of our cases are coming from. At the beginning of December, we were seeing about 30 cases per day of COVID being diagnosed. By the 4th of January, which is the highest number of cases that we've seen today, that went to 537 on one day. So you can see, and I know you'll be aware of just how quickly COVID-19 once again got a grip of the borough and has really now manifested in significant pressures within the health and social care sector. So our cases, I'm pleased to say, are starting to reduce from this very high point, but they're still extremely high. We've still got a rate of above 800 per 100,000 population, and we've got a positivity rate of around 20%. So this is all, as I say, manifesting itself as significant pressures on the NHS and social care. We've worked hard to make sure that our surveillance system is robust and that we're able to publish data when it has been verified by Public Health England. The report also talks about the engagement and communication work that we've done. This is fundamental to make sure people understand why the stay-at-home message is so important at the moment to reduce our case numbers. And we've developed a network of community champions across the borough, and we have been asked to present at a national conference about the work that we've done in developing community champions. There's also comment in the report about our work with Merseyside Fire and Rescue Service and the BAME and faith sector as well. Whilst we're in national lockdown, it doesn't mean that there aren't outbreaks, because of course we've still got a lot of people going to work because they can't work from home. So we have our outbreak hub, who we're working closely with those venues who find themselves trying to deal with outbreaks, and there's been significant work taking place across a number of settings across the borough. Also, since I spoke to you back in November, you'll be very aware that we launched on the 7th of December asymptomatic testing across the borough in 4 sites, which local people really took advantage of and used those sites significantly before Christmas. Since the lockdown, and because where we can, we should be staying at home, those sites in line with Liverpool City region boroughs are focused on those people who need to go to work. And we've also introduced an appointment system as well, so that we can manage the queues better, because of our high case number and positivity rate, we really need to make sure that we're able to make sure we've got social distancing and that queue management is in place. There's also commentary within the report about our work around contact tracing, which will definitely come back into its own once lockdown ends, so that we can get on top of outbreaks, put the appropriate support in place and make sure that our society can go back to normal as much as possible. Lots of work also taking place through the humanitarian cell around supporting our vulnerable people and communities, and again there's commentary within the report. So hopefully, Chair, you can see, and as you are aware, there's significant work taking place in this field, both to deal with the current situation around the lockdown, but also to plan for when the lockdown is eased. But as we've heard nationally, that will take place in a very measured way, and we need to make sure we've got all those systems and processes I've talked about in place, so that we can make sure that we can go back to, as I said, living a normal life as possible, because actually we know that by going into lockdown, the peak is just being suppressed and the virus is still here. So we need to make sure that we have all the systems and processes I've talked about ready to go. Thank you.
Thanks very much for that, Julie. Yes, you're quite right. I am very, very much aware on a daily or even hourly basis about the phenomenal work that's going on by our teams. It's absolutely, I think we're definitely setting a really shining example. Right, I've got Councillor Collins and Councillor Frost. Councillor Collins.
Thanks, Chair. Thanks, Julie, for that. It's just a thank you. One of the biggest comments, or one of the comments we used to hear about the council, is lack of communication. We certainly can't say that about what's gone on with yourself and the team. It's been fantastic. I know personally from the faith sector that you've been heavily involved and that the team's been given a lot of information out there. So that's really, really good news. And then as part of the multicultural organisation committee, again, the BAME community getting that information, well done to the team with what you've done, because, you know, as I say, in the past, communication has been a downfall of this council, and that definitely can't be said of the team that's dealing with the COVID. So thank you very much for all the work that's going on.
Thank you, Councillor, and I'll certainly pass that on and make sure the team knows that. Thank you.
Yeah, thank you, Councillor Collins. Councillor Frost.
Thanks, Chair. Councillor Collins took the words out of my mouth. Julie, it's the same perspective of mine. A huge thank you to yourself and your team for the work you're doing and the way you're updating us. I've got a number of residents, as I'm sure many do, who call on a fairly regular basis just to get the latest feel and to get an update, and a number of them appreciate particularly calling after we have this meeting, so that they can hear the update from yourself if they're not able to tune in, and it gives them great comfort to know the work you're doing, and it's really helpful, I think, to understand that you mentioned you'll be presenting at a conference on the community champion work, on a number of other things. So yeah, a huge amount of pride, I imagine, for yourself and your team, so thank you for your work. Thanks, Chair.
Thank you, Councillor.
Thank you. Councillor Jordan.
To thank you as well. I think you've been doing an absolutely stupendous job. I don't know how you manage it, to be quite honest. I just wanted to ask you about vaccination hubs. Are the borough in places like sports centres, and particularly in areas like, I mean, I know there's one open today in Blackburn Cathedral, but to engage with the BAME community, then perhaps opening in places like mosques, synagogues, temples, or whatever we might have in Wirral, to bring them in and to kill this idea that the vaccine is somehow some sort of conspiracy, whether it be that it contains pork or whether it be that it contains a chip.
Thank you, Councillor Jordan. The NHS is leading on the vaccination. They're opening up various hubs, but I'll certainly take your comment back and feed that into Simon Banks and his team. And we will be working with the CCG around working with the particularly our vulnerable communities and the BAME community particularly, so that we can get the facts out to people so they can make their decisions based on the evidence.
No. Oh. Okay. Oh yes, Councillor Gilchrist.
Yes. As you know, a number of Julie pretty well every week, if not 2-3 times a week, in leaders and other meetings. But members this evening have, across party, expressed thanks for all that work that's being done. And I wondered if it's appropriate for the committee to place on record its thanks for all the work undertaken to date, and express our hope that all this work will continue to produce results that we look forward to.
Appropriate. Yeah. Entirely appropriate. And did I hear that as being seconded from Moira?
It was actually Councillor Cannon, but I'm sure everybody feels the same way.
I do apologise that I've confused you. Right, so seconded by Councillor Cannon then. Any other comments? Any other hands? Can't see any other hands. Okay, so thank you very much for that. We're asked to note the contents of the report and the progress made to date, and to support the ongoing response. So can I have a mover and a seconder for that, please? Yeah.
Happy to move that.
Thank you, Councillor Jordan.
Happy to second, Chair. Councillor Berry.
Thank you, Councillor Berry. That's good. Thank you. Okay, so we're now on to item 14. We've got Simon Garner, who is going to explain to us about the deprivation of liberty, or the DOLS decisions that have been made and the impact of COVID on making those best interest decisions. Simon.
Thank you, Chair. Thank you, members. So this report sets out the importance and context of the work surrounding deprivation of liberty safeguards. It sets out some of the issues and challenges during this period, and it also talks briefly about what lies ahead in terms of legislative changes to come. The about DOLS is it is a procedure prescribed in law, which is there. It's very necessary at times to deprive someone of their liberty as a resident or patient who lacks capacity or consent to their care and treatment. And the deprivation of liberty safeguards is there to keep them safe from harm. And you'll have heard probably a term called the acid test. And this was particularly featured in the Supreme Court judgment back in March 2014, where the person must be subject to continuous supervision, but also the question of whether someone is free to leave. And that question is not simply whether they're trying to leave, but what the reaction of those who support him or her would be if he were tried to try to leave. So some of the challenges that the report is talking about relates to the current pandemic and how we've continued this work, and how in each case where an assessment has been needed, consideration has been given to how we conduct those assessments. For some people, it has been too distressing to do, and other considerations have been taken to review that individual's situation and their needs. It's also been a time when we've had to think about people at the end of their lives due to some of the issues around COVID and how that's perhaps left some about the fact that DOLS doesn't really apply to that group in the same way. And the report talks about how we prioritise given the amount of work. So one of our challenges is just the sheer how we deal with those, that we use a national tool developed by the Association of Directors of Adult Social Services that looks at high, medium and low priority groups, and we have to do that because the numbers are so significant, and there are certain groups that we need to attend to more quickly to make sure those individuals are safe from harm. And so those sorts of considerations in that tool would be around whether somebody is actually attempting to frequently leave, whether somebody needs some physical intervention to prevent it, signs of wanting to leave or trying to leave their care or hospital setting. Going forward, we have got something called Liberty Protection Safeguards, which has been delayed partly just to the process of bringing in new legislation, but also due to the pandemic. And as that comes into play, there'll be some benefits from new legislation, but some challenges too, which we'll probably be reporting on at some future stage. There's a group, of course, for whom DOLS doesn't immediately apply, those in care homes and hospitals. It does readily apply to, but there are people who live in the community, perhaps people living in supported living or share lives type services, for whom we then need to consider a call to protection application. And there are relatively few of those in terms of number in Wirral, Liberty protection safeguards is likely to see an increase in those groups and those numbers. What should be happening is that when restrictions might be required to keep them safe, and considering a court of application in the course of that assessment. So I hope the report's been clear and that my sort of highlights have been helpful. And Chair, happy to take any questions.
Right, thanks very much, Simon. I mean, dolls is complex. There's no doubt about it. At this time of night, again, there may not be after 2.5 hours for committee. Councillor Jordan.
Yes, sorry, Chair. I know it's late, but dolls is something that I feel quite. I know that dolls does obviously assess the capacity of an individual, but we all know capacity fluctuates, so it's very difficult to determine whether that person really does lack capacity, because they're perfectly entitled to make a stupid decision, even if you don't agree with it, but they may have capacity. I'm querying how assessments are done during the pandemic, particularly for those people who find it difficult to communicate. They can't necessarily communicate electronically, say, for example, they're visually impaired, or they're deaf, or they can't speak. So it's incumbent on the assessor to understand what they're trying to communicate. It's not incumbent on the person being assessed. The thing that has always concerned me is the fact of when dolls is in place at end of life. And I really do think that, I mean, it's something I worked very hard to do when I was working in dementia. And I note from your report that paragraph 321 says, no provision in Schedule A1 once someone is subject to standard authorisation to discharge it unless one of the qualifying requirements is no longer met. Well, I would suggest that if somebody's at end of life, the fact that they want to leave or go for a wander down the road when they're actually in bed hooked up to a syringe driver is not likely to be met. That provision is no longer met. And I would have thought the end of life care team would have been having some compassion and would have been rescinding that order. And I do hope that in the new provision that they'll be able to do that.
Was that a comment, or are you looking for something back from Sam on that?
Well, I'd like some assurance that at end of life that something will be done to make life easier, not only for the person who is dying, but for their family.
Thank you.
Okay.
As I understand it, there is, but
certainly with the new liberty protection safeguards, there will be a requirement to more regularly review. So that would be an opportunity to look again and think again about that individual's situation.
Right, yes. I mean, at least they're no longer the property of the coroner. I suppose that's something.
That was a disgrace.
It absolutely was. Any other comments? No. Do you want to take your hand down, Mary, if you're finished? So we're being asked to note the report and the ongoing work. I have a proposer and a seconder for the recommendations, please.
I'll propose that.
Thank you.
Seconded, Chair.
Thank you. Right, so that takes us then on to quality. Discussed in some detail earlier on in the earlier item around performance report. Jason, do you want to mop that up?
Thank you. Yes, I agree. This report is really outlining the approach that the quality improvement team takes and how it works with partners to improve quality in the care homes, particularly those care homes and services that are inadequate or require improvement. I think a lot of it was covered previously. I think I would just like to add that although we have services, we do have some very good quality services too, and I would probably just want to give a balanced approach to that, and to say that did fantastically well with us as a council through the pandemic response, and have kept supporting people throughout the pandemic. So we have not stopped quality improvements and working with those providers on improvement plans where they're required. We've had to do it differently, and as soon as it's safe to resume. So I'm happy to take any questions, but probably I won't go through the detail of the report given the earlier conversation.
Yeah. Are there any further questions for Jason on that? Okay, thank you very much, Jason. So we're asked to note the report and the ongoing work. Mover and seconder.
Propose that, Chair.
Thank you. Thank you very much.
Thank you.
Thank you. The next item is the committee work programme. Certainly when we discussed it as spokes, we decided in the light of the fact that we are moving to a reduced agenda for all of our committees, which is one of the reasons why we're clearing the decks, I suppose. Tonight these were all reports that were already done before the decision to move to reduced agendas. But given that we didn't see a great deal of point in this stage at planning a work programme, unless any members have changed a view or have any other thoughts on it. I really think we need to see what happens with the pandemic before we start to think about what we do in future work. Any comments? Anyone disagree with that?
Could I make a comment if I may, Chair?
Yeah, of course you can. Yes.
We were discussing what might or might not go in future public health annual reports. And in the present circumstances, I can't envisage Julie and her team having time to even think about an annual report. But I'm wondering if by November we were in a situation where things appeared calmer and more stable, we might give some thought to what we could look at when I won't going to say the dust has settled, but when we've emerged, hopefully, into a time when there's less pressure. There are issues we always looked at in the past that we haven't looked at, and we do need to look at as public health, and perhaps it's something that the Health and Wellbeing Board might address as well. Thank you, Chair.
I'm sure it will. Thank you for that, Councillor Gilchrist. And I'm glad to see your optimism that we'll be able to do that by November. Councillor McLaughlin.
Thanks. It was just to say yes. I mean, all the party leaders did agree that for the time being, until the situation with regards to the COVID is easier and presents less of a strain on the officers, that we would just concentrate all the committee agendas on the three main priorities of the council at the moment. And I don't see any reason why we wouldn't be going along with that for the time being. Sadly, hopefully we will have a time when we can look at a broader agenda again.
Right. Well, thank you for that. So on that basis, this brings us to the end of the public part of the meeting, and I'm going to move now an exemption. I'm going to say goodbye in a moment to members of the public who have been watching the webcast, and if you've stuck with us through all this time, thank you. Thank you for your interest. But now I have to say that under section 100, bracket A, bracket
Chair,
4...
if I could just say the actual report is not exempt. So if members want to discuss the matter in public, you can do, but there is an exempt appendices. So if members wanted to ask questions or discuss the information in that particular appendice, then we would need to move the exemption. So it may be that you wish just to have the report introduced in public and then move the exemption just so members can then consider the appendices.
Right, thank you for that, Vicky. Right, any views? Does anybody feel that they want to discuss the exempt item? No? Right, in which case, let's have this introduced in public then, in which case, sorry for the members of the public I said goodbye to. You're welcome to stay. But please be careful with the appendices, and please no comments in respect of that. And if people want to comment on that, can they let us know, and we will move into an exempt part of the committee. Thank you. Okay, that's, do you want to introduce that, Graham? Is it you? Yeah.
Good evening, Councillor Nolan.
Oh, it's Jane Marshall. Sorry, Jane.
Yeah, good evening, Councillor Nolan, and good evening, members. Yeah, this report is to update on the brand new extra care scheme that is to open in Sorgall Massey in mid-March, and the tender exercise that's been undertaken to commission the care and support for that new scheme, which is to be called Poppy Fields. And you will remember that this scheme has been built on the old Wirral Court site in Sorgall Massey. The recommendation that we're asking for is that they agree the outcome of the award, which of course is in the discrete appendix. Just in terms of background, Simon has updated on the strategic vision for extra care and the developments of new schemes, including those in the pipeline. This scheme, in fact, is 78 apartments, brand new apartments on that scheme. You will see in there the procurement timetable that has been added and undertaken as we've gone along. The contract is due to start on the 15th of March, and pending the outcome of this meeting, we'll be looking at the mobilisation phase with the provider between January and March of this year. The contract is a 5-year contract with break clauses included. And the care provider is to ensure 24-hour background support, including for the individuals within on a banded basis. As all of the providers that are able to tender have been tendered either through the Wirral framework or in fact the new wider Liverpool City region framework, and they're all paid at a standard rate. We've been able to evaluate the submissions on 100% quality measures, and all of the providers that have tendered have been through our existing accreditation process to arrive on the framework. So the budget attached to that is within the within the report, totaling over, of course, £3 million to deliver these schemes, this scheme over that 5-year contracted period. And I think there's nothing else to say unless there are any questions before we move on to the exempt element.
Anything, any questions, any comments? Certainly to welcome very much the that development of Poppy Fields, very much needed. And I think earlier on this evening we've expressed our support for extra care housing. But it is a very much needed development, and I have to say, from what I've seen of it from the virtual look around it, I really look forward to seeing the actual place itself. It looks absolutely great. Might book a place, I think.
I think it will be a flagship scheme, Councillor Nolan, and of course Alpha will base their regional team in that building as well from a housing perspective, so that brings additional space to Wirral. Good.
Okay, any other questions? Anybody want to discuss the exempt part of the appendices? So in which case we'll move into an exempt mode now.
Councillor Nolan, if we could just, we will still need to move the exemption in order for the appendices to remain exempt. So members may need to decide to support that.
Which was what I was going to do before. Right. Okay. So what we now need to do, if I can find the words which now disappeared from your message, Vicky.
Would it help if I read them out, Chair?
It probably would, because I can't remember what they said now, because it was a complicated message. Yeah, please do.
Okay, I shall read them out. I do apologise, members. These words are normally printed on your agenda, but in this case they weren't. So the wording that we would ask you to move is that under section 100A4 of the Local Government Act 1972, the public be excluded from the meeting during consideration of Appendix D to the extra care housing tender report on the grounds that it involves the likely disclosure of exempt information as defined by paragraph 3, which is information relating to the financial or business affairs of any particular person, including the authority holding the information of Part 1 of Schedule 12A as amended to that Act. The public interest test has been applied and favours exclusion.
Thank you.
Could I just ask, Chair, if I may, have we actually formally passed the recommendation of the part that was and has been to date been in public about the award of the contract to the provider?
I'm about to do that. Councillor Gilchrist, do you want to move that?
Yes, I'll happily move that. Thank you, Chair. That's the recommendations set out in the report.
Oh no, we did that one. The order of the grant we did, but then we need to.
Right.
Yeah, we've awarded the grant, but it's the award of the care and support contract.
That's right. Yeah, thank you. Should I move then that the Adult Social Care and Health Committee agree to the award of the care and support contract for Poppy Fields Extra to the provider who is named as Provider F?
Right. Seconder, please.
I'll second that.
Thank you very much, Councillor McLaughlin. Right. So in which case, do we have a mover and seconder for the wording for the motion to make that item exempt?
I'll move that, Chair.
Thank you, Councillor McLaughlin.
I'll second that.
Thank you, Councillor Jordan. And I think that finally, that actually brings us to the end of the agenda. I'll just wait until our legal officer tells me no, it's not, and there's something else. But I really do.
Correct, Chair. I think that's
it all
this evening. Yes.
Right. So it certainly has been a marathon meeting, and I apologise for that. But I did warn the spokes when we had a meeting that it was going to be. It's inevitable. But I think given that we're moving to the COVID position of having much smaller agendas over the next period of time, I think we have dealt with a lot of important and outstanding items now, which hopefully will enable our business as usual work to go ahead alongside the COVID work. So thank you all very much for your participation tonight.
You, Chair.
In a good and productive meeting. Thank you all. Thank the officers so much, and I do apologise for having